we have no idea what causes asthma. And that's a bit worrying given that we've done probably decades of research looking at what the specific risk factors are. It's a big problem in New Zealand. New Zealand has one of the highest rates of asthma in the world. About 1 in 5 to 1 in 6 children are affected by asthma. About 1 in 4 children wheeze. These are really, really high numbers. 300 million people worldwide affected by asthma. In adults, about 1 in 6 to 1 in 7 people affected. So this is a very prevalent disease, particularly in New Zealand, and that's one of the reasons why it is important to find out more about why people develop asthma in the first place. And if we can't find out specifically why that is, then at least we should try and develop better treatment for asthmatics, because not all asthmatics benefit from current treatment. We used to think that asthma was all caused by allergies. We now know from HRC funded study that were done here that half of the asthmatics are actually non-allergic, so they have airway inflammation that doesn't resemble what we typically see in an asthmatic or allergic individual. So what we're currently trying to find out is what the underlying mechanisms are that causes airway symptoms in those asthmatics. That if we know more about the mechanisms, then we can better intervene in the disease process. So we're looking at what sort of bugs live in the airways. Up until recently we thought the airways were sterile, but in fact we now know that there's lots of different microorganisms living in the airways, and we believe that part of those, what lives in the airways, may actually determine whether children develop asthma or not. If we know more about which specific microorganisms cause asthma or are associated with asthma, then we may be able to intervene, we may be able to change what's actually happening in the airways, and that may help current asthmatics, or it may help developing vaccines of some sort to try and reduce the risk of developing asthma. So we're working now with people in Central America, South America, Africa, 2 centres in the UK, and our centre here in Wellington, and we're driving that sort of process. So these are sort of cutting edge studies that aren't done anywhere else at the moment. In particular, one of the things I'm very excited about is we're looking at the involvement of the nervous system, which is something that for many, many years we suspected might be involved, but very little research has been done, and that's a study that we're currently undertaking. I'd like to say that I'd like to help people, which is true, but my main drive is really I want to solve a puzzle, and these are very complex puzzles. And I think the HRC has been fantastic in supporting not only our research here at Massey and at the Centre for Public Health Research, but more generally they've been the driving force behind most health research in New Zealand, and they've done an excellent job. That you would expect me to say that because I'm on the board of the Health Research Council, and I'm also the chair of the Public Health Research Committee. But even before I commenced those roles, I was convinced that the HRC was doing a fantastic job, and without the Health Research Council we wouldn't be able to do all this research.